Yeah, again today we are back. This time, with yeah, again today we are back, and this time around we are going to talk about the gut health. Yeah, today we are going to talk about the gut health. You know, one area that is so much neglected around the globe. I don't know exactly why it's actually neglected, but we hardly focus actually about the health of our gut, and that's to say the digestive system, mainly the intestines. When we talk about the gut, we are mainly meaning the small intestines and the large intestines. So, and now when we talk about the gut health, we are really including the small intestines and the gut and the large intestines. But today specifically, we are actually going to focus about the large intestines. Yeah, and in this case, in the large intestines, we are going to mainly focus about the normal flora that we have in our intestines. In our large intestines, there are very many bacteria which reside therein, and actually they are so much beneficial to our health. So much beneficial. We have mainly known bacteria for being the bad bugs in our body. Yeah, it's true, very many bacteria are actually bad to our health. They cause very many diseases. But it is also true that there are very many good bacteria which reside in our intestines, especially the large intestines. Yeah, these bacteria should not be in the small intestines. When they grow in the small intestines, that one is not bad, but they should actually be in the large intestines. In the large intestines, they are very, very beneficial. So you find that actually there are trillions and trillions of bacteria in our large intestines, and there are also other microorganisms like the viruses and the fungi, which are actually normal in our intestines. But the biggest percentage, over 90%, it's mainly the bacteria. We are mainly talking about the bacteria in our intestines. So these make up the biggest percentage. So when we talk about the normal flora in our intestines, large intestines, there we are mainly meaning the bacteria. So, but now where is the issue? Where is the issue? Yeah, we have them, so what? Yeah, we have them, but the main challenge that we are facing, we are really constantly disturbing these bacteria. We are constantly disturbing these bacteria in which way? Very many times we are actually taking antibiotics. We take antibiotics, which is actually not bad, because we are taking these antibiotics mainly to hit at these bad bacteria. Like someone has typhoid, you know, typhoid is caused by bacteria, which mainly resides in the intestines. So you want to fight it, of course you will need to use the antibiotics. You want to fight H. pylori in the stomach, you will use antibiotics. You want to fight UTI, you want to fight the infection in blood. So you find that many times we use these antibiotics and we need to use them. But again, after using them, how many times do we actually go back and we use probiotics? Because these antibiotics that we use, every time we use antibiotics, we actually use non-selective antibiotics. In our setting, we always use broad-spectrum antibiotics, and these antibiotics are actually non-selective. When they kill the normal bacteria, when they kill the target bacteria, they also go ahead and destroy the good bacteria, which we actually need. So you will find that this collateral damage will done on the good bacteria will actually reduce the good beneficial bacteria. And these bacteria, we need them. They help us in very many things. Themselves, they help us in fighting off the bad bacteria. They help us in producing very good amounts of vitamin B7. They help us in producing large quantities of dopamine. And as we know, dopamine is actually a key brain chemical. a key brain chemical and in showing how beneficial it is actually to our body. All these people who have Parkinson's disease, it's because the dopamine neurons, they are degenerating, and some people end up getting those signs of Parkinson's disease. So, like as we have talked, we really need these good bacteria, good bacteria. So when we take lots of these antibiotics which are doing collateral damage, they really destroy those good bacteria, and we don't remember to replenish them, like taking the probiotics. Probiotics are these supplements or drugs which actually have these natural friendly bacteria. Like they are supplements, but they have these natural friendly bacteria. So you find that every time we use antibiotics, we don't actually remember to use some probiotics, at least to replenish these natural friendly bacteria. And then the other thing that we do, in very many cases, we people, we don't eat remembering that we have some bacteria which also need to be taken care of. Like you only eat for yourself, but we don't eat for two. But the idea is we should actually eat for two people. As you are eating for yourself, the food which is going to go in your blood, you should also remember to eat for the bacteria. These normal flora which are in our intestines. As we are eating, we should also remember feeding them. And for them, what they feed on most is mostly the fibers. These bacteria mostly prefer the fibers, but when you look at ourselves, we really take low quantities of fibers. And in this case, which foods are high in fibers? Foods like the vegetables, these vegetables have lots of fibers. Foods like avocado have lots of fibers, even whole grains. So, but it's mostly the vegetables, the wide range of vegetables, the cabbage family, very many kinds. So, but you find that many times we don't take appropriate quantities for these fibers, because these bacteria, they are feeding on these fibers and you're not giving them enough fibers. So in many cases we eat for ourselves, but we don't actually look at our bacteria as we are eating. So that's why they also end up adopting, because we are feeding on a lot of starch and lots of wheat, the pizzas, what. So they also end up getting accustomed to eating on the starch, which is actually not their primary food. So the truth is we don't take care of these good friendly bacteria, and in this case that's why we end up with lots of inflammation in our intestines. So you will find that very many people, a very big percentage of us, we really have a leaky gut because of the inflammation in our intestines. And what's owing to this inflammation? One is neglecting these good bacteria, because they help us in fighting this inflammation, and we are not actually taking care of them. So it's no secret that we are ending up with lots of inflammation in our intestines. We are ending up with lots of inflammation in our intestines because, one, we are not taking care of this good bacteria, and yet we are taking lots of food which are pro-inflammatory. Like look at ourselves, we are taking lots of wheat very many times. And wheat, what it does there, even if you're not so reactionary to eat, at least will leave a mark causing that inflammation. So if you're not compensating all that with supporting our good, natural, friendly bacteria, we are missing a mark. And it's one reason that we are having lots of inflammation in our intestines. So now what is the solution and the way forward? So anytime you have taken antibiotics, let's say you're treating cough, you're treating H. pylori, you're treating typhoid, you're treating whatever you're treating, we should always remember at least to take some probiotics. There are very many probiotics out there on the market, and the truth is that you should not actually take one type, You should try to take a variety, because the species of bacteria which might be suitable for you again might not be suitable for me, or might not be actually enough for me. So you might need to take various probiotics to make sure that you are actually capturing the various species which might be good to your health, actually to your gut and to your health generally. So leaving alone taking the probiotics, if you have not taken antibiotics and just generally in life, we should take lots of fibers. We should always remember to supplement our diets with lots of fibers, because as we have seen, that is good natural friendly bacteria. They depend a lot on these fibers. So at least we should also always remember to support them with the taking lots of fibers. And when we take lots of these fibers in there, we are supporting these natural friendly bacteria, and in supporting them, they are flourishing in our body, and in the end we are getting the benefits from these natural friendly bacteria. And on the other hand, of course, we should avoid some of the foods if possible. Now foods like which have lots of wheat, yeah, lots of wheat, especially refined wheat, is not friendly to the environment, in our intestines. And for people who have inflammatory bowel diseases like chronic disease, ulcerative colitis, so to such people, the taking lots of fibers might not be friendly to them. So meaning such people will need actually to take the supplements directly, because taking fibers might not be friendly to the environment in the intestines. So I think for today, that will be enough for today. Yeah, we shall have more series about the gut health, and in another case when we are not only looking at the intestinal bacteria, but when we explore more about the inflammation in the gut and how exactly could we prevent this inflammation, and what exactly can we do. So that's enough for today. Yeah, still this is Dr. Bweya. Yeah, for more series we shall keep on uploading more series, more medical series about various conditions, and I hope we are going to benefit more.